Hello, my name is Sorawit Amatavete. I'm working at Institute of HIV Research Innovation from Bangkok, Thailand, and I declare no conflict of interest. My talk here is about same-day antiretroviral therapy or same-day ART service during the first wave of COVID-19 outbreak in Thailand. The service has been implemented at the Thai Red Cross Anonymous Clinic since 2017, as at the time we came to realize that our second 95 of the unit's targets has been always around 50 to 70% in the past few years. This due to many barriers includes requirement of multiple counseling sessions, delay in obtaining laboratory results, and the difficulty to utilizing the national health scheme. So the service allow ART-naive clients who agree to same-day ART able to come back for follow-up at the clinics, and clinically eligible, meaning result from chest X-ray was normal and there is no sign indicated tuberculosis or cryptomeningitis, would receive 2-week ART supply on the same day as HIV diagnosis. At the follow-up visits conducted 2 weeks after ART initiation, if client could tolerate ART well, client would receive 8-week ART supply, and they would be referred to their long-term ART facility according to their health insurance scheme. The result shows that the service was highly accepted. It is feasible with the median time from HIV diagnosis to ART initiation was only 1 day, and 96.8% completed follow-up visit at the clinics. However, the first wave of COVID-19 outbreak happening in Bangkok in early 2020, with the highest peak in March, and without any recommendation for ART initiation in response to the COVID-19, we foreseen the disruption of the service. So we incorporated the telehealth into the follow-up visits, which also allow clients who are unable to come back for follow-up at the clinics to initiate ART at all sites, as the telehealth filled this logistical gap. During this time, clients would receive 4-week ART supply on the same day as HIV diagnosis, and they were given an option to either come back for follow-up at the clinics or virtually at home, which can be conducted through a video call via live application. So our first objective is to describe the service outcome in the different period in which the pre-COVID-19, during and after the first wave of COVID-19 outbreak. And the second objective is to assess the client outcome between those who follow up at the clinics and virtually. To summarize the adaptation of same-day ART telehealth in response to the COVID-19 outbreaks, as you can see in the differentiated service delivery frameworks, the ART initiation process follow the conventional same-day ART service, while the follow-up visits on the third column, client will receive 6-week ART supplies, and they can follow up at the clinics or virtual at home based on their preference. ART would be mailed via courier to them. The finding shows that with the incorporation of telehealth, more than 90% of clients accepted same-day ART, with the median time from HIV diagnosis to ART initiation was 0 day, and the interquartile range was between 0 and 1 day. And around 98% in both periods complete follow-up visit without adverse event that prompting the clinic visit. When looking at the retention at 3 and 6 months after ART initiation between client follow-up at the clinics and virtually, both show high rate of retention in care with about 95% or higher retained in care. We also conduct informal interview with provider and client, and both explained that having telehealth allowed them to overcome many barriers. For example, provider could deliver the service identical in quality to conventional same-day ART, while clients seen it as a convenient option and allow them to access the service without taking leave from work or allow those who live in a different province to access the service. However, despite all of the benefits from same-day ART telehealth, it is a labor-intensive work. Some of our staff facing a burnout during the early implementations, which was resolved with a proper task shifting. Telehealth also made it difficult to the non-tech-savvy client and provider as well, And lastly, COVID-19 caused financial difficulty for some clients who might not be able to afford AIT delivery fee, which around $3. In conclusion, the telehealth allows us to continue the same-day AIT service without disruption, with highly acceptable and feasible in HIV testing center in Bangkok. And we decided to continue it and working on the expanding of the service to the community-based organization in Bangkok. We also plan to scaling up the telehealth to other provinces in Thailand. Still, we will need more data on the long-term implication and cost effectiveness of the service. I would like to end my talks by thanking all of the people living with HIV, IHI staff, and our funder, and the community-based organization who contribute to this success. Thank you.